Hello, I hope that you can access the feed. There was a feed started, but then it it I couldn't access the live dashboard. So I'm restarting it, and fortunately, it looks like no one is here yet, and I am grateful for that. So yes, I do two lives a week. One is a Friday about 6:30 p.m. And that actually live is targeting Friday 6:30 Central Time people in the U.S. as well as people in Asia and Australia in the morning, and then Saturday morning about 10:30 a.m. I do a pop up at this time. It's not a scheduled event, but I did it last week. I did it this week. Likely, I can continue to do it every week. So I am grateful for that because um, it's really, I think, helpful for people to have the live interaction. And school is more about like a Zoom call. And of course, Facebook is a little different because they have their own format. And the things we can talk about and the language is also much more, has to be careful. So for those of you who do not know me, I am Dr. Yun Han Kim, an integrative medicine and functional medicine physician, and I'm an expert in LDN. I've been introduced and I have been using LDN for about 20 years, and it's been really an amazing, amazing tool for my patients, and it's transformed my practice because before all I can do is very limited. Now there are several things I can do, but very, very powerful. So the several things that I'm talking about is that if my patients have an inflammatory condition that's out of control, or immune, autoimmune condition that is out of control, often due to inflammation or nervous system or nerve pain issues, then all of these can be helpful. So if you have any questions, just write down in the comment your questions, and I'll address them appropriate way, because our Facebook is very, very strict about what we can and can't talk about in all of the Facebook, all of the meta universe. So, and if you don't have any questions, I can go over some of the ideas that I have had in my blog. And so yesterday we talked about and how LDN works as a opioid blocker, and as an opioid blocker, it also blocks endorphins in the body. So, and what body does is that body will also come overcome that in time. It's supposed to be. But what happens is that there are people who are very low on endorphins, or and they have endorphin deficiency. So the whatever blockade that you do, they get in trouble. And this happens even 1 microgram, and it is a challenge. I just talked to someone yesterday from my practice that 10 microgram, and the person's, I think, having side effects from LDN. So the question is that how about LDN and surgery anesthesia? I'm getting jaw surgery soon. Was waiting to until surgery, after surgery, to start LDN. So if you have not started and you're gonna have surgery soon, and I don't know what soon means, but soon. So if you have surgery coming up soon, I would just start it afterwards. That's what I would tell my patients to. And I have to be careful. I can't say do this, do that, because that's not what Facebook wants us to do. So if my patient asks me that I have a surgery coming on and you just started me on LDN, should I wait until the surgery? If I would say that if it's weeks, then yeah, go ahead and wait for that surgery. That's what I would tell my patient. So in this case, if my patient asks this question, I would say, go ahead and wait and then start maybe 1 or 2 weeks after surgery, depending on you're going to be an opioid. Because I have a schedule. I've scheduled a procedure, and the surgeon is saying that after that I'm gonna probably you'll probably have to use medication. So what I'm gonna probably do is I'm going to get off LDN and order some order or get a hold of 1 microgram LDN, so that if he actually gives me opioid, then I have that that I can take. Or I guess I can just get a bottle and do a dilution myself. So, how does LDN work Hashimoto's thyroiditis? So, Hashimoto's thyroiditis is a form of autoimmune thyroiditis. The autoimmune thyroiditis that there are two big types. One is Graves' disease, which usually causes a hyperthyroidism or high thyroid, and there is also hypothyroidism from Hashimoto's thyroiditis. The hallmark of Hashimoto's thyroiditis is that when you check the antibodies like PTO or thyroid peroxidase antibody or thyroglobulin antibody, usually it's positive. And LDN, I've seen LDN be helpful for lowering those antibody levels. I've also seen LDN not be successful in lowering the LDN, but I think that both people tend to get benefit. Obviously, people like it better when LDN, it looks like the LDN is able to lower the amount of inflammation measured by antibody. What I've seen is that it depends on where you are in the Hashimoto's journey. In the beginning of the Hashimoto journey, what I share with my patients is that it's like factory, thyroid hormone producing factory. And that, imagine that factory is being destroyed little by little. And so in the beginning, there's still plenty of factory capacity to make a difference. So if you can reverse what's going on, then those people are able to reverse Hashimoto's thyroiditis and not need medication. Once you're on medication, some of the people have to lower their medication because LDN is normalizing their thyroid. If they have been on it for a long time, unfortunately, it may be lower the dose at best, not completely reverse it. And the dose also makes a difference. How much people who needed microscopic amount, not so much, but in people who need much more, they probably cannot get off the medication. And when we see the how it's supposed to work, in the beginning I talked about how naltrexone or LDN can block opioid receptors. In this case, we're not talking about opioid receptors. We're talking about toll-like toll-like 4 receptor or toll-like receptor 4, which is located in the glial cell or microglia, which is inflammatory. It's the regulator, modulator of inflammation in our immune system and nervous system. And that, I think, is how, by doing that, if you look at the picture of microglia that is activated, it looks very, very, very angry. And LDN prevents the inappropriate activation of the microglia through blocking the toll-like receptor 4 receptors located on microglia. So, and this person further writes that not very high TPO, but very high inflammation. So the LDN can be helpful for that. And one of the things that is a little tricky about LDN that I'm seeing a lot is the notion of why some patients feel worse before they are better on LDN. And that's a lecture I did yesterday. There's also a blog that I wrote that quotes that, so you can go look at it more. And it's been, I mean, I've seen patients with even MS, not all, but a few patients on MS. Their neurologists say that, oh, I'm going to take off all medication because you're doing so fantastic. Same thing with another patient with RA. The rheumatologist said, oh, you don't need it anymore. So the usually I encourage people to go to their specialist also, and then and in rarely some patients just get very frustrated with their thyroid management, and they're like, okay, I don't want to do it their way. I want to do it more functional medicine, root cause medicine approach, and then a few of them I take over. So there's a few people that I serve as um, their primary for their Hashimoto's thyroiditis. So I don't know how you would know you have high inflammation because our inflammatory tests are still very limited. There's CRP, C-reactive protein, sensitive but not specific. Same thing with SED rate. There are a few people who get their some of the complements tested, and so that would be another way of knowing what's going on. The role of LDN for treating the autoimmune conditions works, in my opinion, the best when you combine it with an appropriate diet that is anti-inflammatory and anti-autoimmune. There are many diets out there, and it's not like one works for everyone. I do know that ketosis seems to work, but really well for me and my patients, but not and there are a lot of different types of to do ketosis. There's not one ketosis. Ketosis that is easiest to do for me is the ketosis that patient is willing to do. So I always ask patient, are you if you had to do ketosis, do you want to eat mainly plants or do you want to mainly eat animals? And then from there, when people say I like both, no problem. If they say I love plants more than animal, no problem. Um, I love animal meat, carnivore. I'm a carnivore, no problem. So everything in between, no problem. It's just that when people say I'm going to be 100% vegetarian, it's a little more challenging because if you're going to get protein in vegetable world, usually carbohydrates kind of come with it, and the whole point is to um, reverse that. So another person wrote here that LDN has lowered my blood sugars, and I have Hashimoto's, prediabetes, Lyme, and Sjogren's. So this is really fantastic. So Sjogren's is a type of autoimmune disease like Hashimoto's thyroiditis, and in my practice, I attract a lot of people with autoimmune conditions because, as you can imagine, autoimmune conditions are increasing in number, and there are also more people are getting it as we're living longer. So so LDN would be able to target Hashimoto's and Sjogren's. And if you really think about um, diabetes, even pre-diabetes, I think that there's a fraction of people that have autoimmune diabetes kind of mixed with type 2 diabetics. And I've seen that in my patients, and LDN and keto diet can even help with type 1 diabetes. So um, that's what I would say. The Lyme is very interesting. Let me see if I can find the article that I wrote on Lyme. But Lyme is Lyme is very interesting, and I have 3 articles written here about Lyme, and and they talk about Dr. Stephen Phillips talks about and let me just I tagged Lyme, and here is my blog on just Lyme, 3 articles. The first article talks about uncommon symptoms of tick-borne diseases, clinical summary with verified references. So this is a bigger article than just tick. It's a tick-borne illnesses. The second one is Lyme Plus model, where Dr. Stephen Phillips talks about the case for infection-driven autoimmunity. And we see that a lot, actually. We see that a lot in the form of MCAS and mast cell activation syndrome. And I don't look at mast cell activation syndrome in isolation. Root cause medicine says what is the root cause. So I've seen multiple root causes, including other autoimmune conditions, Lyme being one of them, and long COVID one of them. It's very interesting because Lyme and long COVID share the fact that it's post-infectious autoimmune uh, activation, and then MCAS to me has that. And in my a long time ago, MCAS was a bit rare, maybe one a year, but now everyone has it. Everyone who comes to me has it. Last several inquiries, that all of them have it. So and for me, I don't know, it's luck, but I've been presented with, God has presented me with patients with MCAS in the beginning of my career, and that really gave me an education. It took me 10 years to figure things out, but because of that, I feel like I have a very good handle on MCAS, and LDN is the cornerstone treatment for any kind of autoimmune condition, including MCAS. So that's been very helpful, that and I think that it doesn't matter who prescribe it. The LDN, it could be rheumatologist, it can be PCP, it can be endocrinologist. It doesn't really matter. I mean, you can go to MD, DO, NP, PA, and some states where ND are, or naturopathic doctors are licensed. You can get it from them, and I don't know other states with who gives what power for licensure, but you can whoever has a license, and there are even pharmacies that have their own doctors. The issues sometimes with that, for me, is it's great, except when you have a problem, then I feel like you're on your own, and people then have to go to Facebook groups like ours. We have a group known as LDN Support Group, and then we also have a website, www.ldn support group. We also have a alternative forum called School, and so it's school.com LDN support group. And we've created all these because of the limitation of the Facebook, and the rules of Facebook is getting harsher and harsher for health groups. We get there are at least 3 LDN groups I know that got disbanded, and there's one that's very strong right now, but I think that they're very for now, I don't see the level of Facebook bots going after health groups, because I know one group that had 500,000 people just disappeared. So the group that we have is LDN support group, and you should be able to find it if you search for it, and then LDN support group. And then the second group we have is also it's not a group, but it's a resource site. It's LDN supportgroup.org. And then Fridays I do a live from school, which is LDN school.com LDN support group. So if you look for LDN support group, chances are you're going to find us somewhere. And we have really great moderators and volunteers. Jill is very active. Charlie is very active, and Paula is very knowledgeable. Tori is not a moderator, but she's also she's moderator for the school group, and we're very fortunate to have these people because they have LDN expertise, and they really want to help other people, and in that's also same with me. I want to help people. There's a limited number of patients I can see. I probably cannot see more than 10 people to 10 to maybe 14 people a day, and that's a really hard day because my patients are very complicated. It's not urgent care. It's what I call ambulatory ICU or walking ICU, people who have multiple conditions, people who have MCAS on top of it, and it just takes a lot for me to give them the time. So the support group is effectively a way for me to force multiply, so that I don't have to see these people. I just have to be careful to not give them advice. I can say, if a patient asks me, I would answer this way. I think that is okay, but I can't say, you should do this, you should do that. Well, that's because your doctor should do that for you. So, and I think we just have another 2 people that hopped on. So if you have a question, Um, yeah, I people in one state begged me, so I did it, and then I currently have no patients from that state. So, and every time I do it, it's about $1,000 to $2,000. So I can't just do it easily. I think California has a lot of people that they're hoping North Carolina, Pennsylvania, your I think this one, and then the other person is a I think I have several from Michigan for some reason, but and it's not certification; it's a licensure. And fortunately, we don't have a federal licensing system. We have a state licensing system. So each I'm licensed in six, and I'm unsure if I would get more. Um, that's why I'm doing this, so that it's people can benefit from this. Yeah, Lyme has a lot in Pennsylvania. You know, the word Lyme comes from the Lyme, Connecticut, I think is the town they founded. But I think something happened to our pathology, for example. And if I talk about this more, they'll probably will get in trouble. So I will not, and you can look it up. But coronavirus is cold virus along with rhinovirus. And we always anticipated an epidemic in not coronavirus because it's influenza virus. So what's interesting is that this time, for whatever reason, coronavirus, not influenza virus, that became epidemic. And I think that that didn't happen before. I have a feeling that it probably will not happen again. It'll be probably influenza virus if it happens again. The second thing is that there are some ideas of, in especially Empire of Japan, were very active in the research of using various antimicrobials to cause as a biological weapon. And of course, in Mongols did that. Mongols pioneered the use of dead bodies from pest or plague, and they would send those bodies over to the over the castle wall, and then the people inside the castle would get it. And I think that that's evolving pathology, and the pathology of Lyme especially is very, very adaptable. It's a spirochete, another spirochete that was really bane of human existence was syphilis, which is not an easy because they hide. And Lyme can hide. Lyme can grow slowly, and it protects it from antibiotics. Antibiotics target rapidly um, growing bacteria better than slow growing bacteria. So LDN makes it very attractive, I think, to use because it. What I tell people is that immune system slows down because of Lyme, and I think LDN allows the time to be restored, combined with other ways, because you cannot just say, in my opinion, there's stories of people who beat spirochetes by going in 100% keto diet. There are stories of people who got better with Lyme. But the way I look at Lyme is that it's a very complex illness that is capable of collaborating with other illnesses in the body, especially if they're autoimmune, and it's capable of creating other conditions like MCAS to protect itself. And when the host is strong, it goes hide. When the host is weak, it comes out to play. So the treatment of Lyme is not just I've treated you, you're done, have a good life. It has to be more of a management idea until we figure out how to really eradicate it. Because I've had one person I met, they said, I did three of the Cowden protocol and three of Horowitz protocol. And Cowden protocol is using herbs, very, very intelligent protocol, flexible protocol. And Horowitz is a like a SEAL Team 6 kind of approach. Three antibiotics, hit it hard, and then cure rate is in the 90th percentile. But for this person, had to repeat it 3 times each. So, and another person is talking about Lyme. Um, yeah, and I think that that like I said, MCAS is a mechanism by which long COVID and Lyme share the pathway, share the defensive and offensive weapon of these conditions. And I think that people who had most fantastic results from uh, the treatment. LDN was a cornerstone, and there are three other cornerstones that I use. And the hard part, I think, is not the treatment; it's finding the right person who who are intelligent and who are able to believe and align. I think that's the hard part. Like SIBO is one of the easiest conditions to treat as long as you don't allow it to become a mixed SIBO where you get hydrogen sulfide. Then it gets a little tougher. In that setting, then the paradigm has to shift. The simple SIBO, hydrogen or methane, can be very easily treated, very easily reversed. The mixed SIBO becomes like more complicated, and likelihood may not be a we're no longer looking at curative for most people. We're looking at making it better, and so that they can live. And I think that I'm happy to see that infectious. We have two examples, Lyme and long COVID, where autoimmune diseases get triggered. And for me, I'm approaching it from the other side, autoimmune side. I just noticed that Lyme people get autoimmune like symptoms, and that's about 20 years ago. I observed that, and then same thing when the long COVID started. I also said I think this looks like autoimmune. It's behaving like autoimmune. So and the other part of this is that because our ED looks for if you're going to die on them or not, and the thing is that like I said, my practice is very different because I understand people have complicated conditions. So what I'm looking for is not efficiency but effectiveness. So I limit my active clientele to 99 patients, and I limit intake of new patients per two per month, and that's because I want to do a great job, and it's not. And I've seen sloppy practitioners who charge tens of thousands of dollars up front, and they do nothing for them, and it's a con. And the people are so nice that they don't go after them, and they don't want me to do anything, so my hands are tied. But yeah, when you go to ER with MCAS or Lyme flare up or Herxheimer reaction, it's hard because it's really hard because and it's not really their fault because they're not educated, and what they don't understand is that some of the Herxheimer reactions will attack the brain, and it will look like stroke. So once they figure out you don't have stroke, they just kind of blow you off because they can't understand it. And it also blow off may not be a good idea, good word. The better word would be that you get classified as non-life threatening, non-limb threatening. In other words, chronic. That's not the issues are not going to create a problem for you right away. And of course, how you feel is not taken into the account of that. So I almost think that there should be a Lyme and long COVID specialist on call for ER doctors and say, hey, I have one for you. We're sure. And that happened actually. One of the patients came to me, had torticollis, and I sent her to ER, and the ER doctor called me and said, hey, I looked into everything. No life-threatening issues. What do you want me to do? I said, send her back. I'll see her during lunchtime, and I'll treat the person. And we're able to get about 75% of the function back, and the person was sent home, you know, better. And Lyme is monster. I agree. The reason for the monster, I think, deserves some looking at. And I'm not saying anything that's conspiratory theory, but I'm a student of history, and I know that during Korean War, which became also partisan war or guerrilla war, it had two fronts. One fighting with China and Soviet, Russian armed North Koreans. But there was a second front of guerrillas, and the guerrillas, Korea is mountain with 75% mountainous country. So there were some guerrillas that fought against, and then they gave up, and then they wrote memoirs. and they talk about one day they stopped chasing them for like a week or two, and as a matter of fact, they couldn't see any enemy forces, and then they saw like an small airplane spraying, and then after that, people came down with what sounds like Rocky Mountain spotted fever, and I don't know that because the guerrillas had operated under primitive conditions, but I do know that that when Empire of Japan lost, they turned over all the biological warfare data to the U.S. government. So, and I'll stop at that before I get in trouble. So it says that yeah, so Hashimoto 05. So I would say that the person with Hashimoto's 2005 already was primed to develop other autoimmune conditions. And Lyme '09, that's diagnosis. And the diagnosis of Lyme deserves a mention because it's really difficult to diagnose Lyme using CDC criteria. And they have alternative criteria that's really difficult too. I think what we have lost is that art of medicine. Um, the art of medicine is not going by cookbook. It's by doing a lot of history, and maybe 80% I would say is history, and maybe 10%, 5 to 10% physical exam, 5 to 10% um, in doing the labs, and 5 to 10% um, imaging. But really, I would say that diagnosis of Lyme is really, really difficult. Most people get infected, they don't know about it. What happens is most people don't get affected, but they get reactivation of the Lyme, or they get bitten again, and then um, it becomes easier to diagnose because it makes you sick. I think that's why when people come to me from for chronic fatigue idea, then I tell them that for chronic fatigue, you have to look at um, the idea of Shine protocol, or and Shine for me stands for sleep. You have to look at sleep. You have to also look at hormones. You have to look at hidden infections, and it's the hidden infections that I'm finding a lot of Lyme suggested. And again, diagnosis of straightforward Lyme is very, 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 very difficult. Um, and I think that that's the difficult part. And it doesn't help that the Lyme camp, I think, is also divided. One camp says that if you have one band, automatically you have Lyme, and then they want to start people on central line and do IV treatment. I'm not convinced at this time that IV treatment have saved individual lives, not population lives. I prefer oral route over IV route whenever it's possible. And if you're going to do IV, then I think, my opinion, not proven by FDA, but using a broad spectrum agent would be better than just a specific agent, because resistance is too Lyme bacteria and tick-borne illnesses. I think their bacteria is too gifted, too talented in being able to adapt themselves and learn from that adaptation. So the next question is alpha-gal meat allergy in lone tick. Um, and this is from lone tick bite, and then you develop a allergy to meat, and does LDN help with that? I think that LDN can modulate the response. I'm unsure there is a treatment, um, and it's really mammalian meat, and I suspect one of my dogs have it. He was found in the street, in a highway, in interstate highway, that my nurse practitioner saved his life, and our family adopted the dog, and we noticed that he's very sensitive to mammalian meat, but not so much with chicken. So LDN, I think that there's a modulation, but it's not a direct treatment, and it's an IgE reaction. So I think that modulate So I think there is a way of treating it, but probably not LDN alone. Probably three. I need three things or four things to treat that. So I had a cavitation in my jaw. It showed Lyme, a ton of bacteria, um, and and there was a root cause. And so it's kind of interesting because when I studied genetics, my professor said everything is genetic. Even if a group of people get hit by a car, there'll be one that will be faster or a better healer that will survive. And some people might say that um, in such case, not you, but in such case, there's a possibility that immune system is not as active as. So I always wonder what would happen if those people were on COVID because patients, my patients on, I would say, I had to qualify that more. My family members during COVID-19, I tracked this, so I knew something weird was going on in China, in Wuhan, because people were just walking and dropping dead, um, and that looked disturbing. And I said, this is by logic. And I'm a physician, but I'm also trained as a public health specialist, and I also have a master's in public health. So, but logically, I said this is looks like airborne bacteria. So what I did is at that time I had extra supply of N95 masks because I used to run a clinic. We had leftover, and I bought what I could, and then I found the alternative, which is KF94, which is 94% versus 95%, and not a respirator but a mask, but it's more comfortable so people can wear it. And there are anecdotal stories in South Korea where people who wore KF94 did not get COVID in room 100 people who were just wearing regular masks. So that gave me some ideas about the the level of. So I'm reading going. I got off distracted, but my point is that people in my family who were long-term LDN users and competent mask called KF94, we did not get COVID. And the best way to not get long COVID is to avoid getting COVID. Best way to not make long COVID worse is don't get reinfected with COVID. So LDN, I think, is very, very important. And here we go. I had PIC line 9 months ago, Zithromax or Cephin, um, and doxycycline. So I would invite you to study and Dr. Horowitz protocol. And Horowitz protocol uses three antibiotics, oral, doxycycline, dapsone, and rifampin. And so that's showed like 90 plus percentile, and actually percentage wise, uh, that's better than antibiotic. But if you're doing it, if it's helping you, that's between you and your doctor. And I've known an infectious disease doctor that 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 treated Lyme, and they did their best to do it. And but I mean, they had like 98. But so it's you can look into Horowitz Lyme protocol. They talk about double dapsone, double dose dapsone, but what I would say is doxycycline, dapsone, um, and rifampin, and that is a triple treatment. And he said like 90 some percent cure of. But like I said, I've seen patients with three times what do you call um, Horowitz, and three times Cowden, the same person, and only then they got meaningful relief. And even those people, I would say that um, it's not cure likely that they went to sleep, and they're talking about 98% symptom relief and about remission about 60%. So then now that makes sense that the person had to do it three times. So the let me go back. So the cavitation story, I think that it's true. I mean, Lyme bacteria is really gifted at surviving. It grows slowly. It can live in between cells, or it can go. I think it can even go inside. It's one of the worst things. And I think that so the other person says they won't use antibiotics. Lyme has been diagnosed with years ago. Offers herbs and ozone. So Cowden protocol is an example of herbs. Artemisinin, oil of oregano, liposomal um, curcumin can all be very, very powerful tools. Now, and ozone, vitamin C are other tools. And just from there, I can tell that this person is more functional medicine driven, but the person is not trained necessarily in ILAD or Lyme literate physician, or the person may be more of a naturopath inclination. But in my practice, I try to use all the tools, including antibiotics, because they're cheap. Doxycycline is cheap. If it's covered by insurance, Dapson and Dapson is not expensive. Rifampin should not be, if it's covered, should not be expensive. Um, and Cowden protocol is good. I also use TCM, LDN, keto, and methylene blue, because methylene blue in high doses work like ozone and vitamin C. It's a super pro-oxidant. I joke that it is a poor man's vitamin C, poor man's ozone. LDN, and there's a question about doses. I kind of laugh because doses I think is highly individual, and that's what most people who use LDN don't understand or are not willing to understand it. But the dose and I have you can go to my blog, and there are many articles about it. But this is an article on how to choose the right dose in ifmsynergy.com, and this is my blog where I used to have several blogs, and now I'm trying to all integrate into one place. And this one has the best search feature. So because my blogs where I have it, the search is not ideal. Where search here is very ideal. So the dose is really, it doesn't really matter what dose, unless you can't tolerate it. Then this article that I put there, like finding your sweet spot in LDN, that article can be helpful. And the other part is that IFM Synergy is all about integrative medicine, functional medicine, root cause medicine, but majority of the articles is LDN. I mean, you can just Google my name and LDN, you will find a ton of things that come up. And as long as you're not having problems, you can start whatever dose. But the issue is that if people have side effects, then usually things get really bad for them. And so that's why at one time I started everyone 1.5, then 0.5 and 0.1. Now I don't do that. I individualize according to the article. There's a table that I have. It's called the Kim LDN Optimal Dose Questionnaire. And I'll try to copy and paste this. But that actually has been very helpful. And that is, yeah, so you can look for the Kim LDN dose protocol, and that's in the finding your sweet spot. And because of the formatting, it just will not show. But that's I would say this is my contribution to the field, and doing this to just answer questions. And I'm doing a pop-up in Facebook because Facebook is very potent in getting people, and I rather have a smaller number of people. And again, that's very consistent with my personality. I have practice that it aims at getting 99 people active, and then working with 2 people per month intensively, and get that. And right now, most of my patients are really doing well, and one person, even at 10 microgram, is having problems. So tomorrow, I'm gonna probably check in with that person and come up with some solutions for that person. I started, so starting 0.25 and then increasing it 3 times a day is not a bad idea. I think that the chances of having side effects is less when you separate it by 6 hours at 4 to 6 hours, because that's the half-life of LDN. That means that if you have 100 molecules of LDN, naltrexone, after 4 to 6 hours, you'll only have half the number, about 50. Another 4 to 6 hours, 25. So that is a way. I think it's an intelligent way of doing it, but no one way is correct. LDN is highly individual. The effect is highly individual. So you just have to understand that it is individual. Individual response is what's the most important, and failure to individualize is where I see a lot of problems. And my heart hurts for those who did not have the expertise, because when you have endorphin depletion, often it feels as if you're going to die. Or severe malaise would be more medically appropriate way of saying that. And it's really, and once people have that, they just swear off. They say, "Oh, I'm not, I can't do it. I'm not willing to do it. I can't do it." And then they don't have LDN. I mean, it's been ruled out because of the side effects, and just because the physician was not smart enough. So I'm doing a lot more what do you call, YouTube and Facebook Live, because I just can't have, I just can't. And here's my clinical website. And the other thing is that, Dawn, you look like you have a physician, so come to our live group on Friday, 6:30 in school, um, school.com /LDN support group. Everything I do is LDN support group related, and I always announce it. So either tag me or ask me to be a friend or follow me, whatever, then you will know what I'm doing. And just show up and ask questions. I can't give you medical advice. I can't give anyone medical advice, um, but unless they're my patients. And I do have in real life practice in Fredericksburg, Texas. So, and people have flown in to see me. So that's a possibility. Um, so Dawn says she gets nauseous. That is an example of LDN, your deficiency, and usually it should get better. But if it doesn't, and I think that that's the greatest fallacy, is that immune system is as individual as all of you, and to say that this dose works for everybody is a bit silly, because that would be like saying everyone should make love this way, and I'm not sure that would work really well if things were and that's kind of the way I look at it. It's like, no, you can't say everyone should eat this way. Everyone should figure out what is the best way to eat, understanding that the requirements may change. I think that may be a better way um, than to say everyone should be a vegetarian, everyone should be eating plants, everyone should be a carnivore. I think the everyone thing gets people in trouble. Like never, always, everyone. I think there's individualization that is being lost because of our society is uh, becoming more mechanic, like automatic. So they like protocols, they like cookbooks. Um, so come to Dawn. I invite you to come to one of those sessions in school, because Facebook does not allow me to if Facebook gets idea that there's a hint of giving medical advice, I can get banned, and my group will get banned. So that's the reason we have moved to school, and there's no rules against giving advice, especially if it's not a licensed person giving advice. Um, so so come to school. There's some person who comes every week, and the person's trying to extract medical advice from me, and I'm not very kind to that person. But person shows up, I will answer it the best way that's appropriate. It's not school issue. It's not that platform issue. It's just a legal issue that I can't give medical advice to non-patients, an ethical issue. And I'm not perfect, but I try to follow the rules. And the rules say that I can only operate in the states that I am licensed in, which is Iowa, Illinois, Missouri, Georgia, Florida, and Texas. And if God asks me to do more, I will do more. But at this point, you just have to understand that getting 50 state licensure can cost $50,000 to $100,000, and probably several. It is a full-time job, so I just can't do that. I have to, and if you are willing to come to, if anyone is willing to come to Fredericksburg, Texas, then should be pretty sure that that would be beneficial before that can be done. So, and some of the people have been very enterprising. They would say that I live in Florida now, but I used to live, and I said, well, I will need a driver's license to prove that you are a state resident, or it could be other documents, state tax, voter ID, or utility bills, I guess, would do also. So it's 6 minutes to go. If there's any questions, I'd love to answer it. Thank you so much for attending our pop-up live session. And I'm grateful to Facebook because without the Facebook, I would not have been able to build 9,000 plus membership. Without the Facebook, I would not been able to implement safety rules. And I also want to thank my volunteers, especially Jill and Charlie and Tori, who's really put in a lot of effort so that I could support people through the Facebook group. So we have 5 more minutes. If no one has any questions, I think I am going to sign off, and I wish you happy Saturday and happy rest of the weekend. Thank you.